You just had a routine checkup, maybe even a minor procedure, and you feel great. You gave them your insurance card. Everything seemed fine. Then, a few weeks later, an envelope arrives. You open it, and your jaw drops. The bill is for thousands of dollars more than you ever expected. Sound familiar? If you've ever been blindsided by a surprise medical bill, you are absolutely not alone. It's a frustrating, confusing, and frankly, terrifying experience. But what if I told you there are ways to fight back and that new laws are on your side? Stick around, because today we're redecoding the mystery of surprise medical bills and arming you with the knowledge you need to protect your wallet. So, how does this even happen? You have insurance, right? Shouldn't that cover it? Well, the healthcare billing system in the US is a labyrinth, and there are several common traps. First, let's talk about the infamous out-of-network provider. Imagine you go to an in-network hospital for a surgery. You did your homework. You checked the hospital. But what you might not know is that the anesthesiologist or the radiologist who reads your X-ray might not be part of your insurance network. They're essentially independent contractors working in the hospital. So, while the hospital stay is covered at your in-network rate, these individual providers can bill you separately at a much higher out-of-network rate. It's like buying a meal at a restaurant and then getting a separate, outrageous bill from the chef who cooked your steak. Another huge factor is non-covered services. Your insurance plan has a specific list of what it will and won't pay for. Sometimes, a doctor might order a test or perform a procedure that they deem medically necessary, but your insurance company disagrees and denies the claim. This leaves you holding the bag for the full cost. This often happens with newer technologies or experimental treatments, but it can also happen with services you thought were totally standard. It's a constant battle between what your doctor thinks is best for your health and what your insurance company is willing to pay for. Then there's the high-deductible hurdle. Over the past decade, high-deductible health plans have become incredibly common. These plans often have lower monthly premiums, which sounds great, but the catch is you have to pay a significant amount out of pocket, your deductible. Before your insurance starts covering a larger portion of the costs, we're talking thousands of dollars. So, if you have a $5,000 deductible and you get a bill for $4,999, you're paying all of it yourself, even though you're insured. This can make even a relatively minor medical event a major financial crisis. These issues create a perfect storm for financial distress. It's not just about the money, it's the stress, the anxiety, the feeling of being powerless against a massive, faceless system. You try to do the right thing. You pay for insurance, and you still end up with a mountain of debt. It can feel like the system is designed to confuse you. And honestly, sometimes it is. But here's the good news. The tide is starting to turn. Frustration and public outcry have led to some significant changes. Enter the No Surprises Act. This is a federal law that went into effect in 2022, and it's a game changer for many patients. The main goal of this act is to protect you from those specific, nasty surprise bills we talked about earlier. Primarily, it targets out-of-network charges for emergency services. Let's say you have a car accident and are taken to the nearest emergency room, which happens to be, before this act, you could be on the hook for a massive bill. Now, the law says that hospital and the doctors there can only charge you the same amount you would have paid at an in-network facility. They can't bill you for the difference. The protection doesn't stop at the ER. It also covers non-emergency care you receive at an in-network hospital or facility. Remember our example of the out-of-network anesthesiologist? The No Surprises Act addresses that, too. If you're at an in-network hospital, those ancillary providers like radiologists and pathologists are generally prevented from sending you a surprise out-of-network bill. The law basically says, if the patient did their job and went to an in-network facility, you can't penalize them for unknowingly seeing an out-of-network provider. Instead of billing you, the provider and the insurance company have to duke it out themselves to agree on a payment. You, the patient, are taken out of the middle. This is a monumental shift in patient protection. It's not a perfect fix for everything, but it's a massive step in the right direction. So, you've received a bill that looks suspiciously high. What do you do? Don't just pay it. Your first step is to become a patient advocate for yourself. The first rule is, never, ever, just pay a medical bill without scrutinizing it first. Step 1. Request an itemized bill, not the summary, the detailed, line-by-line breakdown of every single charge. You have a right to this, so demand it. You'll want to look for things like duplicate charges, services you never received, or ridiculously priced items. Yes, that story about being charged $50 for a single Tylenol pill can be very real. Once you have the itemized bill, compare it against your explanation of benefits, or EOB, from your insurance company. The EOB is not a bill. It's a statement that shows what your insurer was billed, what they agreed to pay, and what your responsibility is. Do the numbers match up? If the provider is billing you for something the EOB says you don't owe, that's a huge red flag. Look for codes. Every medical procedure has a specific code. A simple typo in a billing code can be the difference between full coverage and a full-blown denial. You can even look up these codes online to see what they mean. If you find a discrepancy or believe a charge is unfair, it's time to get on the phone. Yes, I know, it can be a nightmare of hold music and phone trees, but it's a necessary step. Start with the billing department of the hospital or clinic. Be polite but firm. Explain exactly which charge you are questioning and why. Say something like, "I'm looking at my itemized bill, and I see a charge for X. Can you please explain this to me? I don't believe I received this service." Keep a detailed log of every call. Who you spoke to, the date, the time, and what was said. This documentation is your ammunition. If the provider's billing department isn't helpful, your next call is to your insurance company. Explain the situation to them. If a claim was denied, ask for the specific reason in writing. You have the right to appeal their decision. The appeals process can be complicated, but your insurer is required by law to explain it to you. Follow the steps precisely and meet all the deadlines. If you feel the bill violates the No Surprises Act, specifically mention the act. Say, "I believe this is a surprise bill that is prohibited under the No Surprises Act." Billing departments and insurance companies are now trained to recognize these key phrases. Don't be afraid to escalate. Many hospitals have a patient advocate or an ombudsman whose job is to help patients resolve issues like this. If you're still getting nowhere, you can file a complaint with your state's Department of Insurance or Attorney General's office. For issues related to the No Surprises Act, there's even a federal complaint portal online. The key is persistence. Many billing errors are just that, but sometimes you have to push to get them corrected. Remember, you have more power than you think. You are the customer, and you have the right to fair and accurate billing. Dealing with medical bills, especially when you or a loved one is sick, can be incredibly overwhelming. It's easy to feel defeated, but remember that progress is being made. The No Surprises Act is a testament to the power of patient advocacy and collective action. It proves that when enough people speak up, change is possible. The system is far from perfect, but it is slowly becoming more transparent and more fair. By understanding your rights, by questioning every bill, and by persistently advocating for yourself, you are not only helping your own financial situation, but you're also contributing to a larger movement for a better healthcare system for everyone. So stay informed, stay vigilant, and never be afraid to fight for what's right. The path to a more transparent billing system is being built one disputed charge at a time, and you are part of that change. Thank you so much for watching. If you found this video helpful, please give it a thumbs up and consider subscribing for more content that empowers you. And share this with someone you know who might be struggling with medical bills. Let's spread the knowledge. See you in the next video.